Hi, everybody.
Hey!
What a beautiful day for this, right? The 11th hour, and all of you all showed up to tell Congressman Johnson what? Healthcare reform now! That's right. We have a couple of speakers, and of course, we were greeted today. We love America because all sides of the issue can be represented. And so we welcome other opinions, but we know there's a right opinion, right?
That's right.
Woo! I'm going to have our Executive Director, Jim Duffett, open with some opening remarks.
Welcome, everybody. And I just want to say, I know the last time that many of us were here, it was about 10 degrees below zero. And we provided Congressman Johnson a holiday present, and that was a lot of coal because of his previous votes against consumers and in support of the insurance industry. Things have definitely changed, and I would say throughout this whole process, I guess we would say it kind of was like someone who maybe had a gallbladder stone that they had to pass. It's been a tough 14 months of public debate. But this Sunday, finally, Congress is listening to the American people, and finally, health care reform is going to pass. That's right. Health care reform that's going to have a big impact on individuals who not only have health insurance, but people who don't have health insurance. Health care reform that's going to have an impact on small businesses who can't afford health insurance are going to finally be able to get health insurance. Right. Health insurance is going to have a big impact on senior citizens. Don't forget, when Medicare Part D was passed, it was not passed and how it was going to be paid for. It increased the deficit by $1 trillion. This health care bill is paid for. This bill is going to help senior citizens who fall in the donut hole. This bill is also going to be helping hundreds and thousands of young adults to be able to stay on their parents' private health insurance plan. And it's also going to help more kids, as you're pointing to there, to be able to get health insurance. But I would say also one of the other biggest things that this is going to do is once and for all, it's going to end the abuse of the insurance industry. That's doing that. You know, this fight, and I just don't say the healthcare fight, but many other fights that are before us, is really about the heart and soul of this country. Are we going to move forward as a society, or are we going to step a step backwards as a society and support corporate greed versus family values? We know that that's not going to happen. We know that family values are going to win. And the opponents of health care reform are going to continue to spread lies and continue to spread information. Not just between now and this Sunday, but beyond, between now and election and beyond election. And we're not going to allow that to happen. We're not going to give an inch of soil in the state of Illinois, in this country, for people who are going to be trying to demean this health care bill. For those individuals that want to take a position to repeal it, I say go to it. I can't wait for you to get out there and talk about to an individual who has cancer and can't get health insurance because of a pre-existing condition. Go tell that person that I'm going to repeal and take your health insurance away. We know that health care is a moral, economic, and medical imperative for this country. We also know as a society that those Americans who fought hard to pass Social Security, to pass Medicare and civil rights, laid the groundwork and the foundation for a better society. And we're going to move our society forward by passing affordable, accessible health care for everyone here. Why are we here? Do we think that Congressman Johnson is going to be listening to the providers in the 15th District, to senior citizens in the 15th District, to small businesses in the 15th District? Absolutely not.
Hell no.
That's right. We know that he's going to end up supporting the insurance industry like he did. But again, we're not going to allow his misinformation and his rhetoric to be able to control the dialogue in Champaign, Urbana, and throughout the 15th Congressional District. Why is the American public angry at Congress? You know, it's interesting. For 36 years, Congressman Johnson has been on the dole of us as taxpayers giving him health insurance, both as a state representative and as a congressman. I don't say that negatively. I think we as a right for our elected officials should give him health insurance. But he makes the rules in Congress, and he should not be making those rules in Congress and be voting against those of us who are taxpayers who don't allow us to get the same health insurance that he does.
Right.
And I will say in this bill, and at the Senate bill, once and for all, the members of Congress are going to be in the same health exchange as probably 25 to 35 million Americans and their staff also. So what's good for the goose is going to be good for the gander.
Yeah. Right.
You know, the other thing Congressman Johnson's been enjoying about spreading lies and misinformation about this being a big government takeover. Well, we know it's not a big government takeover. But I tell him, instead of talking the talk, he should walk the walk and act like a man. And he should step forward and introduce legislation to once and for all end Medicare. We know, and many of those individuals over there are on Medicare.
Yes,
And we know what a success,
medicine.
that's right, what Medicare is. If he wants to try to demean this process and try to put fear-mongering and scare the American public, he should step forward and he should introduce not only a piece of legislation to once and for all end Medicare, he should also introduce legislation to end the socialized health care system that our brave veterans have through the VA system. And at the same time, he should show the American people and his constituents in the 15th district that he's not going to take government-run health insurance, and he should go out in the private market and try to find health insurance himself. You know, this doesn't necessarily deal with health care, but it also deals with the hypocrisy that many Congress people have. You know, back when Congressman Johnson was elected to Congress, he made a pledge on term limits. I think many of us remember that. And he won by being on term limits. Now, many years ago, he's come out against term limits. That's the type of hypocrisy that's in Congress, and that's why Congress only has a 17% voting record. By Congress moving forward and passing health care reform this coming Sunday, it's going to send a clear signal that it's about time that Congress starts listening to the American people, and they will be listening to the American people. Josie?
Thank you for that. Woo!